Now, coronavirus infections are surging across Africa. At least 1 million new cases were recorded in the past month alone. The World Health Organization says the speed and the scale of Africa's third wave is like nothing they'd ever seen before. Outbreaks are spiking almost everywhere, as you can see on this map. By the end of last week, new cases in Nigeria were up 45% on the previous week, 170% in Botswana, and in Chad, there's a dramatic peak to 200%. The surge is being blamed on two main factors: the spread of the highly transmissible Delta variant, which has now been detected in 21 of Africa's 54 countries, and the slowest vaccine rollout globally. Less than 2% of Africans have been fully vaccinated. That's because of a lack of supplies and vaccine skepticism, among other things. South Africa is the worst hit country on the African continent in absolute numbers, with around 67,000 confirmed deaths, even though the real numbers are likely to be much higher.
This is great progress for Renee, being able to exercise again.
30 seconds to go.
I came in coughing. Today I'm 100% better. The doctors came to tell me that all my blood works are excellent. So I'm responding well with the medication.
Renee Nyker was lucky to get a bed in this emergency COVID-19 center in Johannesburg. A charity organization set up this ward because public and private clinics are overwhelmed. Now they too are struggling to cope. And the recent unrest in the country could help the coronavirus spread even more quickly.
We will soon be facing a huge risk of food insecurity and medication insecurity in a few weeks. Our vaccination program has been severely disrupted just as it is gaining momentum.
The vaccination rollout in South Africa has been slow all along. The riots have made the campaign even more difficult, with vaccination sites and pharmacies destroyed and looted. Food shortages are making it hard for people to avoid crowds.
It's really bad.
If we have members of the public flocking into the shops and malls to buy foodstuff, we are also risking the spread of COVID-19, and it will go to uncontrollable levels with the Delta variant that is currently prevalent in our country.
In the emergency ward, health workers are worried about the number of hospitalizations.
This wave is a lot more aggressive. It's easily transmitted. Patients are now presenting with more severe symptoms too fast.
South Africa has recorded more COVID-19 deaths than any other African country. With only about 3% of its population fully inoculated, speeding up the vaccination rate is now essential.
For more, I'm joined now by Jaap Boom. He's a public health specialist and the regional head of Epicenter. That's the research arm of Doctors Without Borders. He joins us from Yaoundé in Cameroon. Thanks for being with us. Professor Boom, why is Africa being hit so hard by COVID-19 right now?
There are several reasons. You've mentioned it. The new variant, the Delta variant, that is spreading. We have countries like Uganda, South Africa, where more to 95% of the new cases are due to that variant. That is one. Two, also, the distancing measures were no longer applied by the community. So at this point of time, it's quite challenging, considering that the virus is spreading faster and reach the more at-risk population, those who have comorbidity and also the elder. And we are even seeing some young people who are actually in a very critical case, which is quite concerning, actually.
Let's talk about vaccines for a moment. According to the WHO, the World Health Organization, less than 2% of Africa's 1.3 billion people are now fully vaccinated. Is that mainly because there aren't enough vaccines to go around, or is lack of infrastructure and vaccine skepticism playing a big role here?
Now, I think it's important to highlight that more than 80% of the dose has been used in the continent, those that were available. So the challenge right now is really the availability of the dose. Even in Cameroon, where we have intensified the vaccination, most of the doses have been used. You go to Uganda, South Africa, where you show the report, and you have sites where the vaccines are no longer available, but the population are in need. So actually, it's a real crisis. Who actually challenged the issue of solidarity? There is a critical need for those now.
So what needs to happen in order to address this vaccine gap? How will Africans get vaccinated?
There are two things that has to happen in parallel. The first thing first is to make those available in the continent as soon as possible. Two is to strengthen, to accelerate the local production of the vaccine, because we are in the third, fourth wave, and we know that more wave will be coming. And the COVAX initiative is challenged because of what's happening in India. So we definitely need to have those available in the continent for now, but also for the upcoming future.
Just briefly, Professor, what are the risks of not getting Africans vaccinated quickly along with the rest of the world?
I think we are all interdependent, which means that if Africa is not fully vaccinated, we'll have an increased number of deaths, 40% of increased deaths in the last week, which will continue, and that's a real crisis. And secondly, we'll have the emergence of new variants. And those variants will keep on going all around the world. And even all those countries who have already been vaccinated for all the population, we don't know whether they will resist those new variants. So we are all together. And it's important to remember that we are not safe until everyone is safe.
Professor, thank you very much for talking with us. That was Professor Yap Boom speaking to us from Yaoundé, Cameroon.